day. My name is Dr. William Sulkowski, and I'm a general dentist. And the program today is Let's Talk Dentistry. My special guest today is Dr. Edmund Sulkowski, no relation. No. Dr. Ed Sulkowski, my older brother. And we're going to talk today about periodontal disease and how it affects health. If we have time, we're going to talk about nutritional factors that can prevent or help mitigate periodontal disease. We can talk about how to eradicate periodontal disease, and we're going to talk about the systemic effects of periodontal disease. Periodontal disease is gum disease, bleeding gums, abscesses in your gums, things like that. I'm going to start off the program by talking about periodontal disease and some of the ways it affects your health. People with periodontal disease, studies have proven, are twice as likely to suffer from coronary artery disease or heart disease. There is a direct association between your oral health and your heart, and studies suggest that oral inflammation and the bacteria associated with it, with periodontitis, contributes to development of heart disease. Also, other systemic diseases that are affected by and possibly exacerbated by periodontal disease is diabetes. Diabetes affects your overall health, and your overall oral health affects diabetes. Recent evidence suggests that periodontitis can adversely affect a person with diabetes in controlling his or her blood sugar. Also, does gingivitis affect pregnancy? And the answer is yes. That's because increased level of hormones that affect the way the gums react to irritants in the plaque. So periodontal disease can increase the risk of premature, low birth weight, and it poses a greater risk than that of even alcohol or tobacco. So I want to segue over to Dr. Edmund Sulkowski to continue the discussion.
I just wanted to mention to the audience, besides Let's Talk Dentistry, Dr. Bill could be seen at the local comedy club. But in any case, we're going to move to a video now about gingivitis, and then we'll discuss that after the presentation.
Gingivitis is a swelling and discoloration of the gums. There is usually no pain or discomfort associated with gingivitis. It's the mildest form of gum disease, and its effects are reversible. However, gingivitis can be the gateway to periodontal disease, a much more serious condition which can lead to irreversible bone loss and eventually tooth loss. The main cause of both gingivitis and periodontal disease is the accumulation of plaque. Plaque is the sticky film of food and bacteria that forms constantly on your teeth. You must remove all of the plaque each day, or it builds up and mineralizes to become tartar. The blue spots here are tartar. Bacteria that thrive in tartar produce toxins. It's these toxins, combined with your body's reaction to them, that destroy bone around your teeth. Once bone has been lost, it never grows back. When too much bone is lost, there's little support for the teeth. They get loose and have to be removed. That's why it's vital that we treat gingivitis early before it can progress. Though most people aren't aware that they have gingivitis, the warning signs are redness where the gums and teeth meet, swollen gums, bleeding when brushing and flossing, and bad breath. To determine whether or not you have gingivitis, we'll perform a thorough examination. We'll look for any changes in gums shape, color, and contour, and bleeding in the gums upon probing. If we determine that you do have gingivitis, treatment always includes a professional cleaning which removes plaque from teeth, as well as a consistent home care regime and a revisit schedule. In some cases, additional steps are required, which could include using a disclosing solution to determine where the plaque is, a review of the proper use of a manual or electric toothbrush, the use of dental floss to clean between teeth, and using an antibacterial rinse to help kill destructive bacteria. It's important to catch and treat gingivitis early before it progresses and results in the bone loss of periodontal disease.
So what do you want to talk? Are we ready to go? Well, that was a very descriptive film on periodontal disease. Can you talk about possibly how to prevent periodontal disease and maybe some of the nutrients, vitamins, techniques of oral hygiene? We all know that the 6-month cleaning in the dental office is not only for a cosmetic effect to make the teeth look white and pearly and shiny and have that pretty smile, but it is also benefits health by preventing periodontal disease. We have numbers of people, and myself included, I have to have my teeth cleaned somewhat more often than the average person. Even though I brush well, there seems to be certain areas of your mouth on the lower anterior teeth on the inside, sometimes on the outside of the top teeth, the gum side or the cheek side, that accumulates, there are salivary glands in that area, accumulate more plaque, and the plaque gets calcified, and you cannot remove it with a toothbrush. So a lot of people, depending if they're mouth breathers or people who smoke, have to have their teeth cleaned a lot more often. And that whole process does prevent periodontal disease, in addition to some of the vitamins and nutrients that Dr. Edmond is going to talk about.
Well, it's important, of course, the maintenance, and that's your daily brushing and flossing and seeing your dentist and having a professional prophylaxis, a professional tooth cleaning done. But it actually starts with your intake of food. If you're eating poorly, it's going to show in the health of your oral cavity, your gums, your bone, your teeth, everything. If you're consuming a lot of carbohydrates, whether that be in the form of sugars, soda pops, breads, corn, any of those type of things that are full of sugar, and you're not doing a good job of maintaining your teeth, it's going to hasten the damage that's done. So it's important to have good nutrition, and there are a lot of things you can do to supplement because a lot of these nutrients are not in our food. And so you want a good multivitamin, mineral, antioxidant form. And so what you're doing with a formula like that is you're supplying the nutrients that your body needs for good health. Antioxidants are eliminators of free radicals, and free radicals are what do the damage to your tissues, not only in your oral cavity but your whole body. So in taking these antioxidants and amino acids, you are lessening the effects or the damage from these free radicals. So it's important to do a multivitamin, one that you can absorb well. They're, of course, not all made the same, and you need to supplement with a vitamin, mineral, antioxidant, and amino acid formula. In particular, a number of these have special effects in the oral cavity. For example, calcium, magnesium, vitamin D, boron and magnesium, vitamin C, and the B complex are supplements that go into the bone and the gingiva area and help to keep bone solid there, or help to reduce the effects of erosion from bone from disease. I like hydroxyapatite calcium. There are various forms of calcium. My favorite is the hydroxyapatite. Citrate is probably not another bad one. And it helps reduce the damage to the bone when you have an inflammatory response going on. So the inflammatory response can be squelched by such things as vitamin C and the B complex. As well, you want to take some specific anti-inflammatories, and a couple of those would be MSM, which is methylsulfonylmethane, bromelain, fish oil, which has DHA in it, and what that does is help eliminate those free radicals as well. So those things can all be combined to help the situation of disease control in the mouth. Again, it starts with nutrition, and so eating good solid foods, things that are basically on the perimeter of the grocery store, such as carrots, broccoli, cauliflower, good meat proteins in forms of chicken and fish and so forth. And all of these actually go into helping with maintaining oral control. When it gets out of control, then you start seeing the damage that we saw in the video, where you need to go in there and do a number of things in the professional setting to eliminate the disease process. Would you like to add something to that, Dr. Bill?
Yeah, we're going to get back to some of the other nutrients that may help or mitigate or prevent further gum problems.
Well, nutrients in general, they're all going to help. You take selenium, you take calcium, you take vitamin D. All of those are going to go into making a oral cavity of health.
A lot of, so you're saying basically good nutrition up front.
That's the basis of everything.
And the basis of everything. And then if supplementation is needed, then it may be a good idea to do your own research.
Well, such things like CoQ10. CoQ10 is very important. It helps the production of ATP in the cells of our body. We produce it ourselves. As we get older, we produce less of it. But studies have proven that CoQ10 is essential for good oral health, gingival health, gum health. And if you have a problem, a disease process going on, and you take higher doses of CoQ10, it starts to squelch and lower the process of the disease going on. And so you're helping with higher levels of CoQ10. Let's say you're a diabetic. Diabetics, and I know you see this in the office all the time, that their oral health is harder to maintain.
Right.
And they tend to have a lot more of a bone loss and a lot more of gum disease. And we see, as a dentist, we see a lot of these systemic diseases in the oral cavity before they're ever even found sometimes. And so if you're a diabetic and you take things like chromium picolinate, alpha-lipoic acid, CoQ10, garlic, and then the fish oil, even cinnamon is known to reduce the effects of diabetes, and it's important for the oral cavity because what happens is the blood vessels are so close in the gingiva that any disease process that you have going on or any deficiency in there, it affects the gums before it affects anything else. And in reverse, if you're able to administer good health directly to that area, it's going to be absorbed quicker because of the blood vessels being so close to the surface. And as a result of that, there are these supplements that you can augment your diet with that show a direct correlation with improvement, or if there's a deficiency, with disease process. Even taking something like clove oil, which we always had in the dentist office anyway, it's a widely known antibacterial, antifungal agent. So if you have a disease process and you're simply just rubbing clove oil on your gums, it's going to help lessen the effects of that disease process.
Okay. Well, we're going to take a short break here and regroup and talk about more on periodontal disease. This is Dr. William and Dr. Edmund Sulkowski, and the program is Let's Talk Dentistry. Thank you.
Today, there's really no reason to settle for a smile that is less than ideal. Thanks to a dental technique called bonding, you don't have to live with chips, cracks, stains, or gaps in your teeth. When you choose bonding, your dentist prepares your tooth with an etching solution. Then, special composite resin materials are blended in colors carefully chosen to match your own teeth. These materials are applied to your teeth and shaped into just the right contour. Finally, they're hardened with a curing light and bonded in place. The bonding looks very natural because it has been contoured just for your teeth. And bonding can be an affordable and effective way to have the teeth you've always wanted. Ask your dentist if bonding is right for you. For the ADA Dental Minute, I'm Dr. Maria Lopez Howell.
Salam.
Jam.
Salam. Ewa.
Ride. Apa ya Pak? Pak.
Mir. Shanti. เงียบสงบดี
We all want the same thing,
Peace.
and Rotary clubs
Sola.
are making it happen.
How to.
Through international scholarships for young people to promote peace and understanding
La 6.
around the world.
Segnale Zahai.
Rotary. Humanity in motion.
We've all solved problems in creative ways. But the quick fix isn't always the best, especially when it comes to your health. Crooked teeth or misaligned jaws could be signs of orthodontic trouble. Quick cosmetic fixes rather than orthodontic treatment may not be the best solution. Teeth that work better look better, and orthodontists improve the look of the mouth by improving tooth alignment and function. Appearance is important, but it's not everything. For a healthy smile, visit an orthodontist.
Welcome back. I'm Dr. Bill Sulkowski, along with my guest, Dr. Ed Sulkowski. We're talking about periodontal disease, gingivitis, overall health that begins in the mouth. This is a model that is, if we can focus on that, is a representation of gingivitis, where you have a certain amount of buildup around the gum line. Now this is periodontal disease, a representation where you have bone loss and the extensive loss of attachment of the gum. Now, oral health matters. Improper oral health leads to plaque buildup, and plaque formation can lead to gingivitis, which is this representation. In some patients, gingivitis can lead to periodontal disease or severe form of gum disease. And of course, we've said that recent evidence indicates that periodontitis is associated with certain medical conditions. Now, plaque, we can brush plaque away. When it gets hard and calcified, you cannot. That's where the hygienist and the dentist comes in to get that out of there.
If you don't remove, we call that calculus, and if you don't remove that calculus, it starts to inflame the gum area, and then bacteria and microscopic germs get in there and start to cause an erosion of the bone, and actually your gums and your bones start to run away from the disease process because they want to survive, and that's what actually causes your tooth to actually loosen and then eventually fall out, and then you start then having all kind of problems once you lose a tooth or a few teeth. And this calculus can only be scraped away by sharp dental instruments. It cannot be brushed away or flossed away.
This is another representation, if we can focus on that. This is another representation of gum disease, and you can see that you have just some gingivitis with that a little bit of buildup that Dr. Ed was talking about. And now here we have a lot of buildup left untreated and neglected, and you're getting bone loss, red gums, bleeding, food impaction. So how do you avoid the daily plaque buildup on this side that leads to the gum problems on this side? Well, it's recommended that you brush at least twice a day. It's recommended that you floss at least once a day to get rid of this plaque buildup. Actually, in my office, I'm recommending that people brush at least 3 times a day after every major meal, and I'm starting to recommend people to floss twice a day, in the morning and night. It just becomes a habit. What I'm finding is that if you really don't want to have any problems with your teeth, twice a day brushing is, for the average person, because of time constraints, is inadequate. The other thing is the new ultrasonic toothbrushes are much, much better to reduce gum disease and clear it up. And also, when the toothbrush bristle starts to bend out a little bit, they are quite ineffective. Depending on your brushing technique, I think toothbrushes should be replaced very, very often. They're saying a month. I mean, mine don't last 10 days. What about yours?
I throw them away all the time.
Yeah.
Even because of the bacteria build up on there, and so that you reduce in your mouth. It's interesting. I did a lecture yesterday at the middle school at Ken McMillan, and one of the questions that every class, and I think we had 10 different sessions, asked me was, how soon do you throw your toothbrush away? And I started asking, what do they see on the toothbrush? And they started to notice, well, I see my bristles bending, I see this, I see that. So even kids today are starting to be aware of that. And I don't know if they're getting that from the dental office or they're getting that from TV commercials, but they're actually becoming aware of it.
And the other interesting thing about you don't have to spend a lot of money on a toothbrush. I mean, you have the brand names. It should just be a multi-bristled nylon is what's recommended nowadays, and soft. I mean, you can essentially get a bag full of toothbrushes, that are very, very effective, and just throw them away when the bristles show the first sign of fatigue.
And even just if you want to cut down the bacterial count on the toothbrush, dip it in hydrogen peroxide for a while, and then rinse it really well, and then brush your teeth. So.
And what do you think about the oral rinses, like the mouthwashes and
Well, I think you have to be concerned with any that have alcohol in there, because you absorb that. I don't think that's a great idea, or the amount of chemicals in there. And then there's always concerns about changing the pH in your mouth and so forth. So I kind of stay away from those things. There's nothing better than a mechanical debridement.
So essentially, that's exactly what I was going to say, the mechanical debridement. The water picks work to get some stuff out of there, but there is no substitute for flossing and brushing. And that's why, again, I like the power toothbrushes, because they really, really clean teeth and gums to a greater extent than I've seen anything in my years as a dentist. Now, why do you want to prevent periodontitis? Well, again, recent studies suggest that periodontitis is associated with medical conditions such as cardiovascular disease and diabetes. How do you detect it? Well, if your gums are a little sore, when you go into the dental office, the professionals will put a probe into your gums to see if there's a pathologic pocket. You can tell if the gums are a little different color. And healthy gums don't bleed. If you're getting bleeding when you brush or bleeding when you floss, if you are, you have to cut healthy gums to make them bleed. I've had people come into my office and they've said, my gums have bled my whole life. They think that's normal. After we do a treatment of debridement and oral hygiene, and their gums stop bleeding, and it's the first time in their whole life it has. One of the theories is you have these micro bleeds in your gums, and oftentimes you can cause these bleeds when you're chewing something like a celery or meat. And the bacteria that's normal in your mouth, in your digestive tract, is not supposed to be in your bloodstream. When the bacteria gets into your bloodstream, you have mitigating factors, white blood cells, that start to attack this bacteria, increases the inflammation. So essentially, you have an inflammatory response constantly, as if you had an infection, and it's in your blood stream. The same blood running through your brain and your heart and your liver and your kidneys. So the idea being that the bacteria that's supposed to be in your digestive tract should stay in your digestive tract and not get into your bloodstream. One of the ways to do that is to make sure your gums do not bleed. That's one of the reasons why those who have had knee replacements, heart valve replacements, mitral valve prolapse are pre-medicated before they have procedures done in a dental office, because it's the same theory. You do not want to introduce bacteria into the bloodstream, and if you do, you want to mitigate it with an antibiotic. Well, if your gums are bleeding when you're eating, essentially, because you won't notice it, it's not going to be like an open wound, but it's essentially similar to an open wound. Your skin protects your body. You wouldn't walk around with a cut into the environment. It's the same thing if gums are not healthy. You have essentially an open wound that is titrating bacteria into your bloodstream, and that's why you absolutely need to have healthy gums to be healthy. If you do not have healthy gums, you essentially are not 100% healthy.
Well, then you add to the fact the absorption rate of anything that you put it, that the you put in your mouth from the tissue. That's why you have a lot of medications that are sublingual or dropped underneath your tongue, and they're absorbed right away within seconds. Vitamin B is a good way to get that introduced in your system is through sublingual vitamin B. But heart medication, for example, nitroglycerin, why do we drop it under the tongue? Because it gets absorbed right away. So you have that component that's designed, that you're physically designed with, and then you add a gum problem, you're really absorbing this bacteria into your system. And it goes to any place that it can go in the body and lead to infections, as Dr. Bill said, with hip replacement, knee replacement, mitral valve prolapse. Anywhere there's a pocket for it to end up with, or a foreign body where it can go to. So the idea is keep your gums healthy, support it nutritionally, and then you reduce the chance of these things happening.
I believe periodontal disease is the greatest detrimental factor that we deal with as dentists. We can deal with cosmetics. We understand the ramifications of having a nice smile. We can deal with tooth loss. We all know if we have teeth missing, we are not chewing properly. Therefore, digestion begins in the mouth, and if we're not chewing properly, it leads to stomach problems, intestinal
Absolutely.
problems, and elimination problems. So we understand that. But periodontal disease, I think, is the most important, and I think what happens, it elevates the role of the dentist in the overall professional picture of stabilizing somebody's health over the long term.
Well, I think the population in general, as a population in general, we tend to be reactive and not proactive. And as dentists, we're always trying to be proactive and stop the problem before it occurs, as opposed to go in and wait till there's massive disease problems. And sometimes we only see patients when they come in with this massive disease problem. But we try to educate and show that if you take these certain steps, and they're not all that difficult, and you see it, your dental professional twice a year at least, then you reduce the effects of this disease process going on, and you're taking a proactive approach to it.
Teeth should last a lifetime, and in order for teeth to last a lifetime, they have to have periodontal health. But beyond that, the older people that I have in my office, the healthier older people, have healthy gums, healthy supporting structure. In addition to that, they have good function when they chew, which is all tied together. If you have good periodontal health, with the teeth being held in very well and no bleeding at the gums, and people are chewing better, they're overall more healthy. There is an absolute correlation between overall oral health, and I believe as we go forward, because the evidence is mounting very quickly, that the overall health of the mouth begins to reflect on the overall health of the individual. We could look at the mouth and say categorically you're healthy systemically or you're not by looking at the condition of the teeth and gums over the long haul.
Absolutely. You can detect things from fungal infections all the way to diabetes.
So our recommendation, and my recommendation, is that you have your teeth checked, you have your teeth cleaned on a regular basis, minimally twice a year. Follow the recommendation of your dentist, because frankly they're trained in a preventive mode, and you know what, the recommendation, if you went to your physician and he or she said that you had a cyst, and you said, would you say, well, I'll just keep an eye on it and wait for it to hurt me? Well, oftentimes, we don't, as in the population, believe that periodontal disease is one of those things, well, it's not hurting me right now, so I'll just wait until it does. Well, by that time, it's somewhat late. When your gums are bleeding and your dentist tells you that you have a gum problem or periodontal problem, or that you need to have your teeth cleaned more often, do yourself a favor, because it's about you. It's not about the dentist. I mean, in my office, I can only treat a certain number of people, and I'm busy all the time. And whether you, after diagnosis, choose to get it done is up to you. I try to tell you what you need, and if you don't get it done, I brush my teeth and get them cleaned all the time and make sure my family does.
What's that thing you always say, if you ignore your teeth, they go away?
Ignore your teeth, they'll go away. So my advice to anybody listening is to follow the advice of your dentist and your hygienist. They're there for you. And periodontal disease is nothing to ignore.